Hi everyone, welcome to my blog, and this blog is regarding my chemotherapy treatment journey. As you can see, you have already watched, you have seen my journey towards my surgical procedure, which has been a right mastectomy and axillary lymph node dissection and reconstruction. During during the period of my diagnosis, it started actually with 29 millimeters lymph, uh, size of the breast lump that I have, and it was so aggressive that it reaches, I think, yeah, 40 to 42 millimeters. That's what they are, 40, but it's in the, in the surgical procedure, it's 40 millimeters. That's why they have to move forward uh, my surgical procedure because it was so aggressive. And uh, it was grade 2. Um, yeah, and I hope uh, from this video about my chemotherapy treatment, you will know and see how these cancer patients are really dealing with the illness that they call cancer. I had my first cycle of chemo was actually January 8th, 2021. And it is the medications that I have, the treatment that I have is easy. That is ipiribuzin and cyclophosphamide. And on the first treatment that I have, I tried to use the cold cup that they said. They suggested if I can use the cold cup to prevent actually uh, from hair, from falling hair. I tried it on my first chemotherapy treatment, and I wanted to see how it actually, how will it work. Um, but they told me that it's not really guaranteed that my hair will not fall. So I tried it. So as you can see on my clips, you can see on my first chemotherapy treatment that it's I'm using a cold cup. That's what they call the cold cup. And I had my chemotherapy treatment in Northwood Park Hospital in the chemotherapy ensuite unit. It's a day case, so I stayed it for the first chemotherapy treatment I had. It almost take 5 hours. So and they discuss about insertion of portacat or PICC line, and I've chosen portacat. So on my next chemotherapy, they're going to insert the portacat, which I've chosen. My second chemotherapy treatment was after 3 weeks of my first chemotherapy treatment. So they call it like a cycle, cycle of 1, cycle of 2. So I have my cycle 2 after 3 weeks of my first chemotherapy treatment, and it's still, I will be having like 3 cycles of epirubicin, the combination of epirubicin and cyclophosphamide for 3 cycles. That is every after 3 weeks. It's you on my second treatment. I have my portacat inserted a day before my second treatment. That is like January 29. January 28, I had my portacat insertion in the same hospital. And then on the 29th, that is my second cycle of chemotherapy treatment with EC. And they tried to use my portacat, but it wasn't working. It failed. So from morning, my chemotherapy treatment should have started 9:30, but then they tried to flash it. They tried to do everything, but it didn't work. So they have to let me go back to the to the unit that have done my my portacat insertion. They tried several times, and I think 5 times they have to, they have to remove, and I was really sore, and I was so much in pain. For 5 times they have to put the like the catheter in, and then take it out, and they have to stab my chest. If you can see my portacat later, it will be shown on my clips. So they have to insert like 5 times, and it's really painful. It's like a needle that they put it on your chest. So 5 times, and I've already given up because they can't. They said it failed. So they said they have to reschedule taking it out or putting a new one. So when I went back to the chemotherapy ensuite, they have to they have to put the cannula on, and it's really, my veins are all like shrunk, and I was having they were having difficulty of cannulating me, but they have succeeded by putting a small gauge of cannula. So I have that one. So my my second cycle finished at around 4 o'clock in the afternoon. Then my daughter took me home, but I became unwell. At around 8 o'clock in the evening, I became unwell, and we have to call 999 because I have my own, like observation, my like my blood pressure thing, my oximeter with me, my temperature thermometer. So I have my sister-in-law who just came from Bristol, who's about to be with me to look after me for like the weekend, and they took my blood pressure. It was, I was hypotensive. I think my systolic was around below 90, and then I was tachycardic, and my saturation was low. So we called 999. We called 999, and ambulance came, and they were telling me, because my saturation, they were waiting for it to go up, but I was tachycardic. My systolic was low, and they thought they have to take me, and they were saying that they were taking me because of this COVID. It was the peak of COVID. It's January 29. It was peak of COVID that they will take me only in the red because of my saturation was low. And I said, no, I'm not going to go to a red zone. So I've chosen Norwood Park hospital, because they know, they have already records on me. I was having chemotherapy, and my consultant on my oncology was there, so at least they know me there. And I have, because I work as well there, and I have to ask one of one of my colleagues, because I was begging them, I don't like to go to red zone if it's possible in the amber. So actually they said if my saturation will go up, I can go on an amber zone. And I thank our matron Jackie Serrano, who's always there to support her staff, and she's so helpful at the time when I was admitted, and of course my colleagues as well, who's been very supportive with me. And thank you for all of them, and Norwood Park Hospital, and the acute settings. And yeah, I've been admitted. I wasn't able to go in until my saturation, so I begged the paramedics if they can give me oxygen, then I can, so I was on oxygen. And then when my saturation gone up, it was I feel okay, but still my blood pressure, I think my blood pressure has gone up when I was in the hospital. And then I became I think my vital signs were stable, but they were querying sepsis, because I'm on my chemotherapy treatment. So when I was admitted, I developed allergy reaction on tazocine. It's penicillin, and I never have any allergy before. And this was my first time, and it was so scary when you're having that allergy reaction, because the first allergy reaction was I was having itchiness on my back, and I said, this is, it's just like 10 minutes, no, 10 seconds. I was watching at the drip, and I can feel my back is itchy, and then I can feel tingling on my lips, and it's like it's swelling, and like even my tongue was like becoming big. So I called the nurse looking after me, and of course there's a lot of nurses walking, passing by, the corridor, and I was just calling them because I can't, I know there was a bell with me, but I don't know, it's just like I was saying kuya kuya, or please help me, I think I'm having, and I wasn't able. So they ran on me, and they saw, and then all of a sudden everything goes through, something, it was busy, it was chaotic on my side, and I was just like uh, struggling to breathe. And this is my first time, and I said, oh my god, this is how, how you have this anaphylactic you know uh, thing, when you have the situation. It was really scary, and everything was cleared after that, with all this medical emergency, team. I was I was I survived, and it was really scary. But thank you for all the medical team that has been very, very good. And then I have been admitted, and I stayed in the hospital for like a week, and that's where I saw my hair were falling. So as you can see on my coming clips, pictures, uh, my stay in the hospital. During my admission, I have they have to investigate about the portacat that it was inserted. They thought there might be an infection there, so but I wanted the portacat, to be taken out, because it's no point of using it. So I really begged them, because that's the one that's really painful, and I think that's the one that's making everything worse in my body. So they've taken off the portacat, and then I asked them if they can insert PICC line, because that's the second choice that I should have had. But there's no more choice, so I'll have the PICC line to be inserted. So portacat on my admission, uh, uh, in the hospital, portacat has been taken out, and I have a lot of side effects that has been, I know my hair started falling, and you can see on the clip as well. uh, so yeah, my hair was falling, and I have bleeding. It's unexplainable bleeding, which the surgical team have actually checked on it. So they have referred me for flexosigmoidoscopy, uh, and it will be on that week. I think after a week that I have that, I've been discharged, I had that procedure, the flexosigmoidoscopy, and it came negative of all the things that they were trying to rule out. So it's negative, and they thought it's maybe like hemorrhoids. So it was clear, and I'm happy that, because I was thinking, because in my family we have a lot of cancer, from brain, colorectal, breast, and everything. So I thought, oh my god, please. So it's all negative, and thank god for it. And mm, yeah, so it's negative, and then it's just the falling of my hair actually was really, yeah, it was really, it made me cry, because I think it started, after my first chemotherapy treatment. On the second week, my hair was falling already. I've already noticed my hair was falling. So on my second treatment, I never used the cold cut, because I said it's no point, I think, because my hair already started falling. So eh, I want, because it will take time as well, when you're having your chemotherapy, it should stay with you like for 2 3 hours, the cold cup. So it's taking as well the time. So instead of you having the chemotherapy treatment like 3 or 3.5 hours, additional 2 to 3 hours for the cold cup, it's like, you have to spend like the whole day in the chemotherapy suit. And then it didn't work first, so I thought it's no point of me if I'm going to get bald, and it's fine, as long as I'll be fine. Yeah. So I've accepted that I'm going to. I was really crying when I saw my hair was falling, and then I thought, well, if this is how it is, then I have to accept it. If I get bald, then it's fine, as long as I'm going to be treated. So I didn't use the cold cup on my second treatment, and that's it. And on my admission, everything has been done. I really thank uh, the staff from Elgar unit, from Creek unit, and then from Kingsley unit, because I've been discharged, from the Kingsley unit, and my colleagues were all fine, and I tried to become a good patient, and yeah. Just going to show you the room where I've been. The four corners of the room that I had. That's where the cupboard is. That's where the door is. I don't know what's the size of this. It's like 1, 2, 3 by 4 meters. And this is my hospital bed. See how? And that's why I usually sit. It's nice though, the view is quite okay, because I have a view outside. It's a park, you can see. A good air conditioner there, portable one. That's where the toilet is. It's small as well. After being discharged from the hospital, I have to let my brother-in-law shave my hair, because if I, you can feel, it is so painful when you sleep or lie down, or, it just, like when all the hair are falling, and then it's so painful, as if somebody is like pulling your hair, and you can feel, even if it's just like moving, like the roots of your hair, it's really, it's like something is like, like it's moving, and it's like pain. It's like, it's, I don't know how it feels, but it's painful when it, when it moves. So I decided to shave my hair after being discharged from the hospital, and you can see how it looked. My brother-in-law was not very brave to do it on like 0, so he did it like on number 3, I think. So there's some still hair that's, it's still painful, even if, so I wear a cap when I sleep, because when it's when it's like, touches something, and it's like somebody is pulling my hair one by one. So it's better to shave it, and I wear cap when I sleep. So you can see the clip of my pictures that I actually, yeah, have no more hair. I have total 10 cycles of chemotherapy treatment. On the fourth cycle, it was a different medications, that is doxytaxel. The first 3 cycles is ipirubicin and cyclophosphamide, and then the second 3 cycles should have been docetaxel. It should have been docetaxel, but on the fourth cycle, which is this docetaxel, I developed severe myalgia and mucositis, when my peripheral neuropathy was really affected. I can't button my buttons. I can't undo it. I can't do anything. It's just like I was, it's like I cannot hold anything. I can feel anything on my, when I have my medications, when I can't even open, like the packets that I have. So I have to tell my, it's good that my consultant have called me, and then I told her like this. So she discussed with me to change the docetaxel to paclitaxel, that is, paclitaxel, that will be done like weekly for 6 weeks. So I said, as long as, it's not going to give me, because it was really severe. I wasn't able to eat like for 3 days, and every time I drink water, as if I am being choked. So within that week only, I've lost, like, because of my steroid, I was really, I'm really pumped up, so my weight was 66 kilograms, and I've lost, like, I became like 64 something for just a week. No, it's 63 point something, because I wasn't able to eat. I was struggling to eat, but I need to eat something, so I really forced myself to eat something. But I cried, and on my fourth day, because I was just in bed, and I was just like, I was crying because I was about to give up. I said, I'm going, it's, I never get out from my bed and everything, and I was, I was thinking to give up, and then what's the point, but on the fourth day, I tried to get up, go to my, just, I went to the conservatory, and then I've seen the bright shining, and I was just crying that, I'm not going to give up. I'm going to fight, so I'll continue fighting. And that was really, affected my feet and my hands, the grip of my hands, and until now, it's really, that's the severe side effects of my chemotherapy. And my toes are really, at the moment now, my toes cannot feel anything unless you have to press it hard. And I can grip something, but with my this fingertips, it will just slide. I thought I was holding it. I thought I'm holding something, but all of a sudden it will just go. It will just fall from my fingertips. So I always grab things from my from my palm, really tight. If I especially the knife, because I have several times, I was so lucky it didn't go straight to my feet. So 3 times it fell off. It just, because I don't feel much on the end of my fingertips. I can't, even if I grip, I thought I'm holding it, or it's gripped, but no, it's not. It will just fall off. So I make sure I use my the palm to hold everything. Yeah, that's the severe side effects that I have with my treatment. It's my last chemotherapy today. It's May 14, 2021, and my premix are running at the moment. So we're going to take my PICC line later after my chemo. So that's it. That's my premix running. Yeah. And yeah. Now this is the chemo medication, paclitaxel, running now on me. Yeah. That's it. This is the last chemotherapy that I'm going to have, and they're going to remove my PICC line later. They're going to remove this one, which is really good. Nice. Thank you for watching this video about my chemotherapy treatment, and I would like to thank everyone who have prayed for me, especially LSF London, headed by Pastor Hermie Kering, LSF as well, Kilburn, headed by Brother Jiminor Gumangan, and to Sister Cherry Santos, and all of the brethren in LSF who have been interceding on my, on all the prayers. And thank you very much. And to my dream team, thank you very much for all the support that you have given to me when I was admitted in Northwick Park Hospital, and to the chemotherapy suite and Northwick Park Hospital. Thank you very much for all your kind support when I was there during my hard times as well. Thank you very much. And to my family, to my aunties, my relatives, my brothers, of course, my beloved brothers. I have 4 brothers who's been there for me during these times, and my beloved children, my daughter Angelica and my son James. Thank you very much. My daughter has been driving me in and out from all my appointment and everything. So thank you very much. I love you all, guys, and thank you for watching this video. And check out on my next vlog regarding this journey that I've been having. Thank you very much. God bless everyone.